Welcome back. You're watching the Skin Therapy Show, the right information that I personally needed to hear from Dr. Pancholi. But how many of you actually know what skin types you are? Before you can start taking care of your skin, you need to know what to do. And that's why right now on the show, I'm joined by Doris Atieno, who's a beauty consultant. She says she does this for a passion, but it would be nice to not preempt what she's going to say, but give her a chance to briefly introduce herself and tell us about what you have been doing, Doris.
My name is Doris Atieno, a beauty consultant. I've been doing this for 6 years now.
Yeah. That's a long time.
I do it as a passion. Yeah.
Can you briefly take us through some of the skin types that we've got before you can show us how exactly to know this X type of skin?
Yeah. We have dry skin, combination skin, and we have oily skin. Yeah. Sometimes we go to the shelves or supermarkets, we buy products to use on our skin, but you don't know if you're dry skin, combination skin, or oily skin. So you have to do a skin test for you to be sure. Yes.
And let me ask, must it be done by a professional or can you do it at home? Because most people were looking for an option that I can easily go with. I do not want something complicated, something costly. I'm looking for something free, quote unquote. Yeah. So is it something that you can do at home, and what would that mean?
Exactly. We have machines which can do that, but nowadays with technology, we have strips. You can do it at home. We have strips such as these ones. You carry them in your bag. You can go anywhere at home and do the skin test, and you get. We have result chart. You check your skin type through this.
Enough with my talking. It's time to go down to business and get to know what skin types we are. I hope I'll be lucky to also get to know what my skin type is, because I don't know. But take us through the demonstration and maybe tell us what you're going to do and how it works.
Yeah. First of all, I'm going to wipe her. I wipe her forehead and cheek. This is called a quick and easy skin tester. So you just wipe here, the cheek and forehead. I'll take my cotton.
Yeah.
If you have makeup, you can use makeup remover. If you don't have much makeup, you can just use a damp cotton with water. Yeah.
The whole point is to test the skin with nothing on it.
Exactly.
Okay.
For you to get a good result.
Okay.
Yeah. I'll wait for it to dry for like a second. And then I'll place my strips, one on the forehead, the green one on the cheek, and the gray one on the forehead. As you can see, they're clear. I'm going to place them now.
Okay.
Where I've wiped for 15 seconds.
Are there times when the result for this and the result of that differ, and what would cause that to happen?
Never. They can't differ.
Okay.
Yeah. 15 seconds are over now.
I should believe so.
So as you can see, this one has some spots on it.
Yes.
And this one doesn't have much. Yeah.
So how do you interpret this result?
She's combination skin. Yeah. Part of her cheek is a bit oily. It has moisture, and her forehead is a bit dry. Yeah.
So in such a situation, what sort of products do you use? Because I do not know if there are products in the market that come in combination.
We do have.
Okay.
We do have products for combination skin. If you're dry, we do have products for dry skin. If you're oily, we do have products for oily skin. Yeah.
From your paper result, there's a spot, there's a piece of paper that does not have as much spots, and there's one that has much. So what is the difference?
Okay, the paper which comes out which doesn't have any spots, that's a dry skin.
Okay.
Yeah, it's a dry skin. But like hers, it has some spots on it. Not very much, not a lot, but it has some dots on the paper. That's combination skin. With the oily skin, you can see this all over the paper. Yeah.
All right. Last but not least, maybe you can quickly remind us why it is important to get to know your skin type. And if you have any final thoughts, give us as well.
Yes, it is very important to do a skin test. Yeah. First of all, you have to know your skin type before you go out there to pick a product on the shelf to go and use at home. You have to know your skin type. After that, you'll be able to go to the shelves. You see if you have a dry skin, you pick a product for dry skin, or someone can recommend for you. Whoever who is doing the skin test will recommend which products you can use and which one you can't use. Yes.
I must say you have very beautiful skin yourself.
Thank
When I
you.
grow up, I want my skin to look like hers. But anyways, what excuse have you got now not to take care of your skin? It's very easy, 15 seconds and you get to know how best to take care of your skin. This is a Skin Therapy Show. Do stay with us.
Welcome back to the Skin Therapy Show. I'm your host, Sarah Ndano, and I'm here with Dr. Pancholi. Now, Pancholi, let's talk about how diet affects our skin.
Diet plays a very important role with our skin. You want to have foods rich in antioxidants and vitamins. Carrot juice is quite good, blueberries, blackberries. You want to have olive oil in your food. Tuna fish is good. Green tea is quite good. You want to have at least 2 to 3 liters of water a day. And you want to avoid oily fatty foods and trans-saturated fats.
Dr. Pancholi, you've talked about using olive oil and tuna. And someone watching is thinking, this is very expensive for me. Are there any cheaper methods to maintain a flawless skin?
Now, fish in general is quite good because it has high contents of omega, which are good for the skin. The other home remedy that I would like to recommend is you take some honey, sprinkle a little bit of sugar in it, and then squeeze a lemon, mix it up, and then use it as a facial scrub twice a week. What this will do is this will help clear up the complexion, and vitamin C from the lemon has been known to give a nice glow to the face.
Okay. Dr. Pancholi, when I came to your clinic a few months ago, you used the chemical peel to cure my acne. Tell us more about the chemical peel, how many types we have, and other treatments for acne.
If I recall correctly, we did a fruit peel on you,
Yes.
which is glycolic acid, which is made out of sugarcane. There's different kinds of chemical peels that we use. We have the alpha hydroxy acids, we have the beta hydroxy acids, and we have the polyhydroxy acids. Now, basically what happens is, with all these different peels, we want to peel off up to a certain extent of the skin. So we have the superficial peels that we'll use for fine lines and mild acne. We have the medium strength peels that we'll use for pigmentation and cystic acne, and then we have the deep peels that we use mainly for anti-aging. Now, the way a chemical peel works is it's applied superficially on top of the skin, and once applied, it's left on for a certain amount of time, and then what happens is after 2 to 3 days, you notice that your skin starts peeling, and you can actually peel off the top layer of the skin. And when the skin comes out, then it allows fresh and healthy skin to grow from underneath. And when the top layer of skin comes out, it comes out with all those blocked pores and the clogged dead cells and everything that we had talked about. So all this comes out and you get a new vibrant skin coming out. And
You actually feel younger.
absolutely,
Yeah.
absolutely. And somebody was asking me, Daktari, if I peel off all my skin, won't there be a time when I won't be left with any skin? And the answer to that is chemical peels actually cause stimulation of collagen. So they cause fresh and healthy skin to actually grow. So you're stimulating skin, so there's no way you'll peel off all your skin. So it's not something to be worried about.
Okay. Is there a particular age when you're meant to start using the chemical peel? And how many times can you do this in a year?
I have some patients that come for a monthly chemical peel.
Oh,
Yeah, it helps with anti-aging. It gives you a good glow, and it keeps your fine lines and wrinkles at bay, and it helps reduce pigmentation. Why wouldn't you do it?
How many sessions for you to have results?
Between 3 to 5 sessions in general,
Okay.
and you're normally okay.
I will now be reading some of your questions that you have sent on Twitter. Dr. Pancholi, someone is asking, hi, Dr. Pancholi, you're very inspiring. Thank you so much. I suffer from pigmentation. How can I be treated for this? And someone else is saying, hi, Dr. Pancholi, I'm a mother of 2 and my kids are suffering from eczema. What are the best measures and treatments I can go for? And do you offer that in your clinic?
Pigmentation is a very common problem in African skin. And there's different kinds of pigmentation. So I would need to see the skin to be able to assess it. Sometimes we have pigmentation after acne. So basically once we get the breakouts, then the spots go away, but they leave behind dark patches. The other kind of pigmentation that is quite common in dark skin is something known as melasma. And melasma is due to a hormonal imbalance. There's 2 different kinds of melasma. We have the epidermal melasma, which is the top layer of skin, and we have the dermal melasma. Some forms of melasma are easier to treat than others. So I would want to have a look at her, assess her, and then decide on what to do. But chemical peels, which we talked about, would be a good option, as would laser treatment. And sometimes we can even do glutathione therapy, which is skin brightening injections.
All right, somebody is talking about using anti-aging creams. Hi, Dr. Pancholi, my name is Ruth. When should I start using anti-aging creams?
I would recommend that you start off after the age of 30 using anti-aging creams. And what these are going to do is they're going to prevent the skin from getting fine lines and wrinkles. However, in some cases, it's all dependent on somebody's skin type. And some people may need to start a little bit earlier than others. Some people may need to start a little bit later than others.
Okay. And going back to our Facebook page, Daniel is asking, Dr. Pancholi, I'm a guy. Would you advise me to use Botox?
Oh, absolutely, absolutely.
Yeah, because
Yeah.
there's this notion that Botox is only for women.
No. In fact, I personally do Botox and dermal fillers. I get it done. Yeah. I have lawyers coming to get Botox done. I have male politicians that come to get Botox done. And there's so many men out there that are doing it. Yeah. And it's about looking good. It's about feeling good. And sometimes when you look in the mirror and you see these lines, and you see now your cheeks have dropped, and you're like, why should we have to live like that?
Yeah.
Yeah.
What are the side effects?
Okay. Now, all medical procedures have side effects, and all medical drugs have side effects, and even Panadol can give you liver failure. Yeah? So, basically, all treatments will have side effects, but when done correctly, in the right hands, by a professionally qualified person, then you're not going to be worried about side effects.
Kevin wants to know where your clinic is at.
My clinic is at Yaya Center on the 4th floor, and I'm there when you need me.
Specific hours?
I'm normally at Yaya Center in the afternoons.
Okay. Dr. Pancholi, thank you so much for taking your time to be with us today.
Thank you for having me.
Yes. Any last words to people watching at home?
There is a very strange notion amongst Kenyan men that they feel that they don't need to take care of their skin.
Oh, yes.
And just as important as it is for ladies, it's just as important for men to take care of their skin. And there's different skin regimes that they can use. And one of the most important things that I would like to emphasize on is the use of sunblock or sun protection. You need to use sun protection, and an SPF of 30 is essential even on cloudy days. So sunblock or sun protection needs to be used even when you're indoors. And basically what happens is we have UV rays that are coming through the glass and affecting our skin, causing photo damage. They create free radicals that then make the aging process much faster. And I'm sure you've noticed that when you get into a car, yeah, then you feel the heat even more sometimes than the outside. And this is because of the effect of the UV rays, and they're causing a thermogenic effect, the same way they have a photo damaging effect on the skin.
Great, that is very important because I didn't know about that. I only use the sunscreen when I'm, going to the beach. So
Yeah,
very good of
yeah,
you to
yeah.
mention that. All right, thank you very much for being with us today. We hope that you'll be back. We know you're at the Jack of all trades. You are also a cosmetic surgeon, so we hope we'll have another episode where we'll talk about bleaching and cosmetic surgery and the side effects.
Absolutely.
All right.
It'll be a pleasure.
Okay, thank you very much. And thank you for joining us today on this week's episode of the Skin Therapy Show. We hope that you enjoyed yourself. Please do not forget to get in touch with us on our social media pages. That is Facebook, Instagram, and Twitter. Let us see and know what you're going through so that we can offer the best solutions to your skin problems. Until next time, it's been a pleasure having you. My name is Sarah Ndanu. See you same time, same place next week.